because every time he hears me speaking, he seems to want to get involved. So yeah, if you see a tail going across. So yes, so the background to this project then is that I'm a criminologist. So I I've got a background in sociology, and I have been a senior lecturer for, well, I finished my PhD in 2013 now. So my PhD was all about how people who are otherwise conforming citizens, so people who don't break the law outside of what's associated with their drug use, how they negotiated crime and criminality associated with their drug taking. So things like, you know, who they tell, who they don't tell, how they feel about their behavior, those types of things. So I've kind of studied why people take drugs since my undergraduate degree. And basically, the reason that got me interested into this topic is that, you know, I went to university, I'm from Preston originally. I went to university at Sheffield Hallam, and it really was a very kind of transformative experience. And I studied studied sociology, and in my final year, I took a course called Drug Use in Context. And at the start of that course, the lecturer at the time kind of stood up and said, you know, we're going to be discussing things like, should heroin be legalized? And I thought, who is this joker at the front? You know, should heroin be legalized? That is, you know, that is so far out of, no, of course it shouldn't be. And after being educated in this topic and over that 12 weeks, at the end of it, I thought that heroin should be legalized. And nothing has ever kind of changed my opinion so much, and thought about the kind of messages that I'd received about who drug takers were and what drug use is, and thought about how, you know, the reality and the experience was very, very different. So this kind of got me excited into this topic. So I've spent my career interviewing people about that question. Why do you take drugs? What meaning does it have in your life? And at the end of every interview, I always ask people, you know, what do you think about policy? Do you think policy should change? Do you think, you know, the drugs that you take should be legal? And I kind of thought that, you know, people who use drugs would be, you know, would champion legalization or champion decriminalization. However, this question really floored some people. So some people had never thought about this question before. Some people were very politically engaged and had the answers straight away. But I realized that just because you're a drug taker doesn't mean that you are politically engaged into drug policy reform debates. Although you may have experiences and you may have opinions on, you know, the role of drugs within your life or within society. So this really got me interested into this project to try and understand more about people's opinions and people's values surrounding drugs. So I come from very much like a sociology, criminology background, and sorry for the lot of waffle around that. So I'm leading this project, and I, with the help of Dr. Melissa Bone. Now, Melissa has got a very different background to me. Her background is in law, and she studied kind of human rights law and looked at kind of case law and whether drug policy reform should change from a human rights perspective. So both very different backgrounds, but both very passionate about drug policy reform, and in particular, engaging people who use drugs into these debates. So there's global changes in policy, which have been going on for many years. So Portugal, for example, decriminalised all drugs in 2001. So we're 20 years beyond that now. But obviously recent kind of changes in cannabis policy in the United States, Uruguay. And we're having these debates, but are we really engaging those people who have experience into these debates? Like, how connected are these kind of policy reform debates with the people that actually take drugs? So people who take drugs have been, you know, excluded from the debate. There's been varying levels of public consultation across the world. Uruguay is a quite famous example because this was actually cannabis was legalized against public support, and that has had kind of a kind of traumatic journey, I guess, in terms of the legalization when you don't have public support for it. Not going to talk too much about that today. So David asked me in one of the questions when we're having our email exchange. So, you know, also to think about my personal views about whether drugs should be legalized. And what I've put there is hashtag it's complicated. And I'll go on to talking about this, but I would argue, and from the Drug Policy Voices perspective, that perhaps that question isn't the right question to be put into people. And perhaps we can try and understand a little bit more about people's values and their opinions by having this kind of values-led approach. So instead of asking like a question, should X be legalized, really trying to understand the reasons why people might think this and what kind of values do people do underpin people's opinions. So I don't know whether people have heard of moral foundations theory, but there's a book by Jonathan Haidt, which it's the title of it is Why Are Good People Divided by Politics and Religion? And he puts forward this kind of moral foundations that our opinions are based on core moral foundations, things like care and harm, equality and justice, authority and tradition, purity and sanctity, liberty and oppression, and also kind of our in-group kind of loyalty. So I wanted to look, rather than, because I know that the question, should drugs be legalized or should something be legalized, often gets a mixed response. And often you have to know what the term legalized means before you can answer that question. We've stripped this back, the Drug Policy Voices, to talk about different types of values and how they underpin what we think about drugs and drug use within society. So the story so far then. So how we are trying to engage people who use drugs into these debates. So we ran a survey in January, February 2020, so pre-COVID days. We had 1,300 respondents, and the criteria for that survey was very, very loose. And we had some debate about this, because really we could have a whole project on who is a drug taker. Are you a drug taker if you've tried drugs once? Are you a drug taker if you're on drugs now, yesterday, 2 weeks ago, last year? It's quite kind of really complex when we're thinking about current drug use. So we decided to have the criteria: has ever taken an illicit substance. So that is drugs that are controlled under the Misuse of Drugs Act 1971. And there's a big kind of campaign at the moment around the fact that we're 50 years from our kind of big legislation on drugs. But we've also got the Psychoactive Substances Act 2016, which was in response to various drugs, new psychoactive substances coming on the market that weren't controlled by the Misuse of Drugs Act. So that kind of bans any psychoactive substance. And again, really big debate about what is a psychoactive substance there. But basically legislation to control. Under that act, though, the possession of those substances isn't criminalised. It's more the supply. So I'm not going to talk too much. The survey findings at the moment, I know this was well over a year ago now, but as you can imagine, COVID has got in the way of it's kind of halted our project. I'm a lecturer as well, so we've been responding to, both Melissa and I have been teaching as well. So we're still working through the findings of that, the really kind of, the kind of end findings of that. However, I did do a presentation, and if you are interested in looking at the findings there, if you search An Audience with Rebecca Askew on YouTube, I know that sounds a very egotistical title. I didn't come up with that. But I basically discussed the kind of preliminary findings from that survey. But what I will tell you, that despite substance use history, most of our respondents were leaning towards more progressive values. And what I mean by that is that they value individual rights and freedoms to use substances, but also an emphasis on responsibility of one's own behaviour as well. And there was a kind of broader spectrum of rejection that the government should control substances, and that we need to ban substances in order to protect people or to maintain law and order. So people really working on that, my body, my decision. But again, it's quite complicated there. And one of the things that I'm sure you are all interested in as well, is thinking about kind of trust in government as well, and trust in experts, trust and also legitimacy of the law. So people have got to believe in a law for them to follow it, for one. And, you know, there's a big campaign, kind of social media run by Drug Policy Reform Organisation, hashtag 50 years of failure. So there is this movement that actually, you know, this has categorically failed. By banning drugs, it doesn't stop people using them. And really, that, you know, Misuse of Drugs Act is a really moralistic. It's not based on evidence. If we talk about harm, for example, well, again, that's kind of very complicated. If we compare harms of alcohol, for example, you know, we get into kind of quite messy debates there. But the reason that we want people who use drugs to engage in this debate is they're the ones for this policy that really affects their lives. And, you know, we want people to have trust in the powers that be, trust in government, and trust in the law, so that people comply with it. One of the other things about the survey is that drug type matters. So we didn't conduct our survey on any particular type of drug. We asked about different types of drugs. Now, most of the debate has been around cannabis, and I will talk about that later on. But drug type really matters, and I'm sure, you know, you'll all understand that people's views on cannabis are very different to their views on heroin, for example, or crack cocaine versus powder cocaine. And what we really need to kind of put forward here is that people who use drugs are not one homogenous group. They don't all think the same. And, you know, it's we have a kind of really complicated, you know, kind of mix of demographics, of generation, of substance use history that affects our opinions as well. Okay, so we did the survey, and then our idea was that we were going to have kind of focus groups of people to debate these topics, and to debate you know, certain things about drug policy, about the drugs, what impact it has in people's lives. And show people a video. We wanted to educate people about the different reform approaches. But obviously COVID scuppered those plans, and we decided to try and engage people, to start a podcast. Now, the podcast is kind of part of our research. And what we're trying to do through this podcast is present a counter narrative. When you say the word drugs to people, it often invokes a certain type of image of what drugs and who that drug taker is. And really what we are finding that what the kind of the field has found, anybody that researches drugs, is there's such stigma and there's such stereotype that's associated with using these substances. That we want to try and kind of challenge that. And there's a big campaign by Release, who are a drug policy reform organisation, which all on kind of London buses, which was Nice People Take Drugs. And just to try and humanise people and understand, and we've kind of moved since I started this project. You know, we've stopped using the words addict, we've stopped using the words, you know, drug dependent people, drug user, moving on to kind of drug taker, but now we emphasize people who use drugs. So we're putting people at the front of this. So our podcast is there to try and engage people in the debate, educate and inform, and amplify a range of voices. So our podcast episodes so far our first one was about, you know, do we need to reclaim or abandon this term drugs? So some people are really against the term drug. It's full of stigma. Other people try and kind of reclaim that term and say, well, caffeine's a drug, alcohol's a drug, sugar is a drug. Can we not just see all of these things as, drugs within society, so people kind of understand that? We spoke to somebody who's a drug policy reform activist about his identification as a drug taker, how it can be stigmatizing or empowering. We talked about pleasure in drugs in the last podcast. And really to kind of draw people back to the main reason that people say that they use drugs, no matter what substance, is because it has a positive impact in their life, because it's pleasurable, because it has benefits. So we're trying to kind of challenge our understanding and the public perception of drugs there. So we're trying to improve knowledge. We're trying to humanize people who take drugs. So we're going to do 10 episodes, and the last 2 are going to be on policy engagement, because really we're trying to connect people to policy and policy to people as well. And rather than kind of trying to put drug takers into specific groups, we're trying to kind of look at the broad spectrum of drug use and look at what unites us rather than what divides us. So one of the things from many years of interviewing people, and I believe that this is because of the prohibition system that we live in now, is the othering that occurs between different types of drug takers. So it's basically, we're all trying to argue, at least we're not like them lot. So, people who take ecstasy will berate people who take cocaine. And they'll say, well, people who take cocaine just end up, spending loads of money and doing it in their own homes. At least when I take ecstasy, I'm doing it in a club and it's about socialization and being with people. People who smoke cannabis often can berate people who drink alcohol and say, well, cannabis isn't as harmful as alcohol, so at least I'm not like them, and vice versa. So we acknowledge that this occurs, and it occurs because people are trying to defend their position. And, we are worried about criticism and those types of things. So rather than trying to say this type of drug use is better than that type of drug use, we're trying to kind of come together, try to destigmatize, and empower people as well to kind of talk about their experiences, because if we don't know why people take drugs, then we can't respond to it. There's a lot of assumptions that are made about why people take drugs without actually speaking to people who take them. So we've done the survey, we're in the midst of our podcasts now, and what we're trying to do next is engage people in the debate. So using kind of qualitative research. So we're inviting people either to tell their personal story and their experience. We have a research assistant who is a poet as well. She's been engaging with people who are writing poetry about their substance use. So a way of kind of people telling the story, that it doesn't have to be an interview. It doesn't have to be a group discussion. One of the examples is, writing a letter to your parents or writing a letter to your children about the meaning of drug use in your life. One person wrote a letter to their parents about why they, only come home in the early hours of the morning, and talking, about their drug use there. It's kind of how you would speak to somebody if you didn't feel like you were going to be judged for what you're doing. We're going to also run some group discussion groups as well, and we're going to move that online, and I think that has lots of benefits. We can see that this group of people are kind of meeting online, and we all know how to kind of video conference now, and even people who are in treatment, for example, they have been meeting on that line, they've been connecting in that way. So we want people who know each other to come together to discuss. And we're in the midst of actually coming up with some ways of trying to engage people. And what we'll be doing is we'll be presenting like little vignettes. So one of the things we'll do, so for example, explaining somebody's situation, talking about people, should it be allowed that people can grow their own cannabis in their own homes for their own personal use, and ask people to debate that. Because we're not asking a direct question about legalization there, but we're getting to understand why people would support that and why they wouldn't. What are their worries? What are their concerns? So it allows us to kind of engage in that way without kind of making it really, really political. So where are we up to? How long have I gone on for? About 20 minutes. So David asked me this question about should cannabis be legalized? And I'm glad you did ask me this question because it's a good one. But for our project, I'm not sure this is the right question for the public, because do the public know what a legalized system would be? Do we know what a legalized or regulated system would be? You know, asking the public a question with a simple answer, as we have seen through Brexit, has really divided a country. And the reasons why people voted either yes or no, you know, weren't explored. The education systems or the how people were informed to make that decision was very political as well. And actually that question maybe is only relevant to policymakers or a politically engaged section of the public. So my personal view is yes, I would say, you know, we need a depenalisation of all non-violent drug offences. We can see disproportionality within the criminal justice system. Black people are stopped 9 times the rate of white people on suspicion of having drugs in their person. However, we know from surveys that white people are far more likely to take drugs. So we can see that that's racist. That is that's a racist system. If you wanted to, you know, catch people who were taking drugs, you could have police stood outside university halls. Why don't they do that? Why are they in Moss Side, where I live? You know, why are those communities being policed? So this is a power that the police have, that is being disproportionately used, and our understanding of who the drug takers are is skewed because of this as well. So what we know about drug takers is who's in contact with the criminal justice system. So we know that as a public, who's in contact with treatment, and probably through our own networks as well, you know, maybe the media. But we know that there's only a very small proportion of people who are ever processed through the criminal justice system, and a very small proportion of people who will ever go into treatment. So we're missing out the what's kind of known as the silent majority. So we think drug takers are those who are in the criminal justice system or the treatment system, but there's lots more in between. So go again, should cannabis be legalized? Yes, I think yes, but I'm also worried. So there is a move to this. We can see increasing support. But I would be very careful to think about why is the support and who is supporting this and who will profit from the cannabis industry. This could be, you know, we can see what we're increasingly seeing is it will be in control of a few people, and it'll become a capitalist system. And it could be that this is pushed forward rather from a public health perspective or an equality perspective. It'll be pushed forward on a profit-making enterprise. And therefore, are we doing this for the right reasons? Are we protecting people? Is there enough support out there? So it is a really, really complex question. And sometimes, as I say, you know, it's not about drug policy, but it's about inequality as well. So when I was setting up this project, I was very fortunate to go to the University of New South Wales in Sydney, and I was having a roundtable discussion with somebody, and somebody said to me, you know, you're somebody who is living on the streets and who is injecting drugs doesn't want to debate decriminalisation with you. You know, that's not their concern. It's almost like this is a political concern. But they do, you know, what we need to ask them and what we need to look at is, you know, what are the kinds of things that will help you? You know, how could your life be improved? And often, you know, when we're thinking about this, there's often like a lot of inequality within society. Certainly, you know, when we're thinking about why people are taking drugs on the streets, is very different to why people might be taking drugs in other aspects of life. So smoking cannabis in your own home, for example. So it's complicated, basically. I hope that was okay. I'm really open to questions. There's so much that I could talk about here. Please do visit our website if you're interested in knowing more. We're also on Twitter. So that's the policy, the project's Twitter, and also my own personal Twitter, and then our Instagram as well. So I'm happy to have a debate with people about this. I'm happy for people to ask more questions, and hope you enjoyed my my little waffle.
I thoroughly enjoyed your little waffle, and I don't think it was a waffle either. I learned so many things from it. Could you take your notes off, please?
Yeah.
Yeah, great. Because what we'll do now, if people actually want to ask questions, now one person already got their little yellow hand up. All right, which is Monty. And then I'm going to go to Lisa. So we'll go to Monty first and then Lisa. We'll do the 2 questions first, and then we'll go back to yourself, Rebecca. Is that all right? Cool. Monty. Monty.
You're on mute.
That little yellow hand was a clapping hand. However, I do have a question, and thank you very much. I was really taken by that, and I was trying to think of a project that took place, I think, in Halton or Warrington or both a few years ago, organised by a medical doctor. I think his name was either Marks or Mars. Does that make sense? And he had government funding to support with medical grade morphine, I suppose, everybody who came to his surgery. And it was discovered that all kinds of different levels of people, educated, uneducated, professionals, labourers, unemployed, they all could continue functioning, some of them at a very high level of intellectual capability, as long as they were funded in their usage of that substance. And I'll not call it a drug, because if we give it a, as it were, a non-pejorative term, they're absorbing a substance. We're absorbing bits of plastic all the time without realizing it. They were absorbing a substance which apparently was making no measurable difference to their performance. What it would do to them long term, I have no idea. But I believe that, I'll come to the question in a minute, that project was defunded. What's your view, if you've got a view on that, about experimenting with projects of that sort?
Right. Come to Lisa now with your question. A person who spent her youth in Brighton.
Yeah, I did. I don't remember.
Do you remember much of it?
Am I? Can you hear me? Am I off?
Yes, we can hear you.
Yeah. Okay. Right. Well. I suppose I kind of refer to what Portugal has done. They've seen, and I don't know what your opinions on that are, but they've decriminalised, and they've seen, including heroin, and they've seen a massive drop in deaths and actually probably usage as well. I'm not sure what the statistic was now, but definitely deaths have definitely dropped. But what I wanted to just ask you about was, and I think this goes back to the perception of the public and the values we place on it, is that 3 years ago, I went to a symposium called Street Drugs in the Northern Powerhouse, which I don't know if you were there or knew about it, but they had the fantastic David Nutt there, who of course is an advocate of decriminalisation, isn't he? And he was the drug czar and was sacked for, having this outrageous, unorthodox, highly suspect, blasphemous position on drugs. So, because drugs are bad, full stop. Yeah. They had the wonderful Neil Woods I don't know if anybody's read Good Cop, Bad War. He was an undercover policeman who had to masquerade as a drug user without actually becoming addicted. I mean, that's quite extraordinary. He said that criminalizing drugs and treating it as though it was a war on drugs just means that the whole environment gets more and more dangerous, because criminals, the actual baddies, the criminals will find increasingly violent means and also dangerous means, like really drug cutting's always happened, it's well known, but they will really find ways of doing that, and they will brutalize users who don't pay them immediately. So by creating a war on drugs, by the police creating a war on drugs, means that you actually harm drug users and society a lot more, because of the it fuels violence in the criminal world. And then I also saw people at that symposium from Loop, L-O-O-P, for those who don't know it. And they were describing the difficult, because they did research as well, I believe you may have come across that. What they do, or one of the things they do, is at festivals, they invite people to hand them their drugs, and they will test a small portion of it to see whether it's cut by any substances, or actually, I suppose, whether they've got value for money. You know, it might be just grass cuttings or something. Or if there's kind of, things like rat poison and all kinds of stuff that gets put in. Washing powder was the great big one back in the late 60s, in the heroin. They cut it with a friend of mine nearly died from that. But the difficulties they have is that when they hand the drug back to the person, it's the person that's bought it. So at one level, then they're handing it back because they're not keeping it, they're not stealing it, they've tested a little bit. But at another level, are they supplying drugs? So that was a difficulty she'd explained. So I understand exactly what you mean about this. It's complicated, but I just wondered if you had any thoughts on those references I made.
Thank you, Lisa. That's cool. You've got a couple of questions there, or a couple of comments. Over to you, Rebecca. You'll have to unmute.
Sorry. Yes, thank you for both those questions and kind of reflections and stuff. Monty, I'll go to your question first. And I think this is one of the things around, heroin, heroin or, diamorphine is obviously used in for people who are giving birth. So, that is the kind of medicalized heroin, I guess. We use painkillers within our lives, and actually kind of a lot of the time supplying people who are physically dependent. And remember, like I'm not a health professional, I am a criminologist, but providing people with that and their ability to function. There is a book also by Dr. Carl Hart called Drug Use for Grown-Ups that's just come out, and he's a doctor in the United States, and he admits to taking heroin, and is a doctor. And I think that sometimes kind of shocks people in that way. There are a lot of high functioning people, and actually it doesn't have any kind of organic effect on the body. So whereas smoking obviously affects the heart and lungs, alcohol affects your liver, your kidneys, heroin, it doesn't have any effect on your organs. So actually, in its purest form, obviously overdose is a big thing with heroin there. But we use kind of painkillers, and I think if people are addicted to substances and they depend on them, then I definitely would support any kind of initiatives there that are providing clean, safe sources of heroin. There's other fantastic initiatives such as Peter Criken, I think his name is. He's got the he's got a bus in Scotland where he goes around and he provides a safe consumption site for people. So, you know, this is so that, you know, there's been big kind of debates around safe consumption sites, drug consumption rooms. We could argue that pubs are safe consumption rooms. If people get violent, they get kicked out. You know, we've got, you know, people there, we know what one measure of beer is going to do to us. We know what one measure of wine is going to do to us. We know how affects that the body. One of the biggest problems is that if you don't know the strength of something, and certainly for people who come out of either treatment, for example, or prison, overdose is high because your tolerance is low, and you end up trying to use the same amount and then you end up overdosing. So, you know, like that is definitely something about kind of safer consumption. So yeah, I would definitely support initiatives that provide people and empower people to have more control over their lives and their bodies, definitely.
Thank you, Rebecca. It brought out the economic basis of that that issue as well. Thank you.
Thank you. And yes, so David Nutt, Neil Woods. So David Nutt now heads up drug science, and they're supportive of our project. So so that is great. And we've been in contact with Neil Woods. Again, like the Loop, fantastic initiative. So people can go and have their drugs checked. And they give a small amount and they get a 15-minute kind of harm reduction advice. So you will know what is in the substance that you've provided. You'll know the strength of that, and if it's been adulterated. I mean, one of the things is that people are selling kind of you know, things that aren't ecstasy, for example, or there'll be a pill and it might have some kind of psychedelic in it. Or people might think that they're taking LSD, but it actually ends up being one of these new psychoactive substances that often takes a long so there's this thing called N-bone, and it takes a long time to come on, so people can think that they're not getting the effects. Then they'll take more and then they'll get into trouble. And some you know, health, I mean, by that being in health. And there was somebody that once said to me from these festivals, and the one thing that I do worry about is that because people, especially young people, feel like they're going to get in trouble for having these drugs on them, that they actually don't alert the authorities if something does go wrong. So they're less likely to go up to the ambulance service, for example, or, you know, call somebody for help. And that could be the difference between somebody, you know, kind of getting the help they need and not having kind of serious consequences. So someone once said to me, if it's in your body, it's a health problem. If it's in your pocket, it's a criminal justice problem. So that's, you know, kind of something to say there, you know, like, you know, just to try and support, you know, to support people so that, you know, they can make decisions about their own lives, and that we can talk about the, you know, we can talk about the harms and pleasures of substances in the same space. You know, I think that's important to kind of, to be able to do that. You know, just because we talk about the benefits that, you know, substances have in our lives doesn't mean that we're not acknowledging the harms that could happen. Yeah, but I think, and you know, the loop testing is great, but I would extend that, and I would say, you know, make sure the most vulnerable in society, so those people who are homeless, on the streets, or living in you know, unsecured accommodation, they have the same access to drug testing as well, because you know, often this is, you know, it's unequal access. So I would want buses in the town centres so people can test their heroin as well.
Yeah, that's great, Rebecca. Thank you. We have got 3-4 people who've got questions. Please ask the question. All right. We're going to start with Paul. Then I'm going to go to Anne. Then I'm going to go to Lynn, and then I'm going to go to Dave. So Paul first.
Got a couple of questions. A quick one on, I suspect there's a difference between decriminalising and legalising, and I just would like that a little clearer. The way I would look at it is, how would you reduce drug crime and drug harm? And just think, America tried to prohibit alcohol with prohibition, and there's the crime and the methanol from the stills caused so much harm. When they legalized it, they controlled it. Yes, some people get addicted, and that then becomes a medical problem. As we know, there's alcoholics that have difficulty with that. And if you legalize drugs, then I'm sure there's going to be a certain proportion that will get addicted and cause problems. But I wouldn't use that as an argument against it, because I would say, well, if you're reducing the crime and the drug harm, I think that probably is going to outweigh those that will have difficulties, and just to make sure that there's access to medical help services to get them out of that addiction and any problem. Thank you.
Lynn, Anne next.
Right, thank you. I'd like to know your opinion on it's cannabis and the workplace, because I used to represent people who failed a drug test when everybody I've had drug tests, and there were people who tested positive for ketamine and you name the drugs, but the people who tested positive for cannabis, you automatically lose your job. You're gone. And some people even volunteered for the test. They didn't have to take it, they volunteered, but they tested positive for cannabis. So they all lost their jobs. And some of these people have been there 10, 15, 20 years, because that was the policy of the workplace. So when we look at cannabis, they don't see cannabis as a drug. They think it's a smoke at the weekend. So I think when he's talking about decriminalizing or legalizing, I think cannabis should be in not a separate, it should be separately, treated separately, so maybe like smoking. But I think you've got to look at the users that go into work, and to help companies understand the difference between ketamine and people who smoke of a weekend, because they don't see it as drugs, and I've seen a lot of people lose their jobs.
Lynn.
Thank you. That was a great presentation, Rebecca. Thank you. I wanted to ask a little bit about Portugal's experience. I liked your question about who profits from decriminalisation. And I want you to consider really, do you think people are more or less likely to be exploited if it's decriminalised?
Thank you, Lynn. That's a great question. David?
Yeah, thanks for that. Rebecca, that was a really interesting talk. And I mean, I was taking copious notes here because it was just a lot of things that you were saying. I think, you know, it's another study in itself, I suspect. But just two things, really. The first thing is to say that I have a family member who, when he left university, had aspirations to work in the drug rehabilitation field, but after 12 months he gave it up and has never gone back to it. And I've had long chats with him about this, and it's obviously goes beyond the purview of what we're dealing with at the moment. But he did say at one point that you know, he said, when you talk about drugs, one of the things that you don't see on there is booze. He said, and if you're looking at categories, you should never, ever forget that booze is a big drug. I'm talking about alcohol, obviously, and within that broad range. And the other thing is a little bit of an anecdote here. Now, you mentioned, you know, inequality. A few years ago now, I was involved in running a fairly substantial course, and on that course were several senior police officers. The area shall be unnamed for obvious reasons, but during one of the breaks that we were having, I got chatting to one of them, and he had quite a senior role. And he was talking about, we got on the business about equality, and he said, He said, well, the best way to describe this, he said, I think, he said, just imagine a scenario, he said, that we come across regularly. He said, you've got a youngster who lives in a very, very deprived area. He can't see any way out of that deprived area. And in a short space of time, or at one moment in time, somebody draws up in a top of the range BM, dripping with gold, and says to this guy, will you take this package to the guy down the road, and there's 50, 80, 100 quid in it for you, just for that? And he said to me, what would you do, Dave, given the circumstances? So I think there's so many issues here, I think, that we've got to absorb here. And of course, goes beyond, I think, obviously what and you've alluded to that, what we're dealing with tonight. So yeah, it's quite a topic, I think. Yeah.
Thank you, Dave. That's
Thank
cool.
you.
You've got 4 questions there, and we've got one other person after this, which I'll come to after you've answered the 4 questions.
Great, thank you. I'm loving these questions. So first one was around decriminalisation and legalisation. So yeah, it's complicated. So decriminalisation can mean a couple of things. So one of them would mean that it would decriminalise use. So drug use, sorry, I'll start from the beginning. Drug use isn't a crime. Taking drugs isn't a crime. Being in possession of drugs is a crime, and supplying drugs, cultivating drugs, those are crimes. So through decriminalisation, the emphasis is often taken away from the user. So to be in possession of drugs isn't a crime, but supply, the market would still be illegal. So there wouldn't be a legal market there. So that it kind of emphasizes that, people shouldn't be in prison, or people shouldn't go through the criminal justice system for being in possession of a drug. So that's decriminalised on one side, but you can also have, so Portugal's decriminalisation is a bit complicated, because it's kind of like, people are, if you're caught in possession more than 3 times, I think it is, then you will go to treatment. You'll go into treatment instead of going through the criminal justice system. So one of the things about that is, great, because it's a health-based approach. But what I have heard, and this isn't something I haven't looked at in depth, but through some research that was done, it's still a way of controlling drug users, for example. So if you are somebody that's on the streets constantly, and if you are stopped and searched more than 3 times, and each time you are stopped, maybe stopped and have drugs in your possession, they're confiscated. So you're not allowed to keep them. So it's a bit iffy there. So if you're somebody who's addicted, you then need to go and get more drugs. So it's still a system, even though it's a health-based approach. And I think we've got to emphasize that is good. It's putting people's health at their core of the policy, but it's still a criminalized system. And it's still, if you're caught so many more times, and it's still enforcing people to go into treatment. And if you spoke to, say, somebody that's smoking cannabis every night, they might not want to or feel like they need treatment. So, it's still kind of enforcing people to do that. So that's decriminalization. Legalization, again, could be different. It's not a legalized system, would usually be through state regulation, in the way that alcohol or tobacco are controlled. So there would be, maybe limits on where you could get that drug from. It might look different for different drugs. If you are interested more in this, Transform have written a lot of blueprints for regulation. So for example, cannabis would be treated differently to ketamine, as somebody kind of talked about, or cocaine. So it might be that you could get cannabis through a licensed shop, you could get heroin on prescriptions. That would be more of a medicalized model. You maybe could go to the pharmacy and get ecstasy, and you might be allowed like 5 ecstasy tablets a month, something like that. So there's different ways in which it'd be legalized, but that would mean that it's not just the end user that it's that it removes the criminalization, but it's the whole system. So the system would be kind of regulated in that way. And, you know, yeah, so different drugs would have different things there. And then there was a question about reducing drug crime and drug harm and sort of that. And so I'm kind of a criminologist, but there is a kind of move through the more critical approaches to maybe zemiology, which is the study of harm within society. So to try it, so I kind of move to kind of reduce harm there. And I think, you know, reducing drug crime, you know, legalized drugs, you've totally reduced drug crime because you've taken out any kind of criminalization. But to reduce drug harm, we need to know what's in substances. We need to know, you know, we need to kind of be aware of why people are taking drugs as well. Things like overdoses to be prevented. If we look at drug consumption rooms, nobody's died in a drug consumption room, so safe injecting sites. So that's a way of trying to, you know, reduce drug crime and drug harm. So drug harm is certainly, you know, reducing it through having a public health focus and destigmatizing. Another thing about treatment is that people will resist treatment as well. People don't want to be in treatment. They can resist that because you know, it's got stigma attached to it. It's basically telling the world that you're a drug taker, and there's a lot of stigma going along with that. So they become resistant to drug treatment, and often that they feel shame and, you know, stigma. So for me, in reducing stigma and reducing stereotypes, and acknowledging that drug use exists within society is the first step to reducing drug harm, because there's harms caused by stigmatization as well as harms caused by drugs. Cannabis in the workplace, yes, so somebody also mentioned that on the chat, that it can stay in your system a lot longer than other drugs. And yeah, I think a lot of people, you're right, a lot of people see cannabis as very different to other substances, certainly that from our survey. So there's much more relaxed attitudes towards cannabis, and also ecstasy, and also magic mushrooms as well, we found. So we found, you know, and there is an argument that certainly with mushrooms that grow in the wild and grow in this country, and the kind of also the benefits that people are having through, you know, their bit psilocybin. There's lots of trials now going on for reducing depression, reducing post-traumatic stress. Ketamine trials as well have also for depression, for people that are treatment resistant to other depression. So these substances can be used to help people as well. And I think the people that I've spoken to certainly see, you know, cannabis as something that really improves their mental health. It's not for everybody. And I think that what I've found is that the more people I speak to, the more varied people's opinions are. So you'll find somebody who finds cannabis extremely anxiety provoking. They don't like the feel of it. Other people, they find it is the only thing that kind of helps them relax at night. And they find it really positive for their well-being. So yes, cannabis in the workplace. And I think for me, you know, drug tests within the workplace, it doesn't, you know, we shouldn't be judging people on, you know, whether they have drugs in the system and whether they're good to do their jobs, you know, like it's, you know, I don't agree with that at all. You know, there, what else did we have? Portugal, who profits and exploited. So yes, the Portugal side of things is, and I think, you know, what worries me is that we will have a system where, you know, businessmen will control the cannabis market. and it will become a profit-making exercise. If I know that Release has been has kind of looked into this, and some organisations and some drug policy reform groups are trying to push forward cannabis reform. But the reason they're trying to push it forward is because they're invested in the cannabis industry, and therefore, if cannabis is legalised, they are set to make a lot of profit because they've been early investors in the business, and therefore, you know, from my political view, this should be about health and it should be about rights. It shouldn't be about profits. And there's lots of other things like kind of social equity models, and also, you know, the fact that I've got a colleague who studies kind of drug suppliers, and really from his perspective, the people that he speaks to, it has been working class males who have managed to save up a lot of money to start their own legitimate businesses. This is often about, you know, it's entrepreneurship in some cases, that actually that people, you know, are kind of making money kind of that way. What have I missed? I feel like I
don't know.
Does anybody feel like I didn't answer the question?
No reply. No reply.
No.
So we'll go on to the final two questions, if you don't mind. I don't know who to go to first because they live in the same house in totally different rooms. So I'm going to be a gentleman, even though that's not very popular these days. And Andy can go first because he was before you, Vicky. Andy, you're muted.
Is that better?
That's much better.
Okay, great presentation. One of the questions I was going to ask you've actually addressed, which was the use of drugs for people who have had PTSD. And there's going to be a lot more PTSD about because of what's happened in the pandemic. And ketamine is one of them that is a kind of serious drug if you take it in the wrong doses. But done properly, it's allowing people to actually go deep into their psyche to be able to address those issues that have brought about their distress and trauma. But I was just wondering what you think about, or if you could tell us more about the other drugs that are used in that. Because I know in America, they had to do an awful lot of work to get a legal right to do the trials with ketamine because it was illegal. And it took a long time to get the, whatever it is, the state legislature or the national one to be able to do that. And is there a similar problem in England? Could research be done on that? And is it blocked by law? The other thing I wanted to come to is should it be legalized? And I think it should be, but I agree with you. It's hugely complicated. And who benefits from it? Yeah, that is a big one because it would just go to the cap list. But not if it was state run. What's wrong with the state running it, the state administrating it, and the state taking, if you like, if there is a profit out of it, the profit is for social good rather than for private greed. And I'm just wondering whether whether you think that a lot of people take drugs for the reason of getting through the system. It's about getting through the day. You know, if you and how do you get out of what the despair you feel of living in this society with this system, you know? And at the moment we've got the climate change, and in that you can't change the climate unless you change the system. That's what's coming clear to most people. And I would think, and I would suggest that maybe you can't change the ideas on drugs so much because it's a symptom of the system. Because if people didn't need to escape, they might not need the drugs. They might just do some meditation or some other ways of finding some inner peace. And finally, my drugs of choice are sugar and food, and they're highly addictive. And I've put on a stone during lockdown because of that. And that's part of my coping mechanism. And I was wondering what you think about sugar in particular, whether that should be banned as a substance, given what it does to everybody.
Right. Thank you very much indeed, Andy. Vicky.
Thank you very much, Rebecca. I learned so much and I'm very naive around this topic. And I need to, I've got some like world views and basic views, but they're not based on an educated view, which is that's a big black hole in my knowledge, and I need to address it. But from first principles, you said it was a health and rights issue, the question of legalizing it. And my question is, can you think of legalization within the context of capitalism? And because that of all the dangers that are in it that you've talked about, and really, can you solve the problem if it is a problem? Drug taking is a problem. Can we solve it without changing society? And I think it reflects a little bit on what Andrew says, because although it's an overwhelming topic, my temptation is to look at the causes of the drug taking, which you alluded to. And I'm just wondering whether it is a majority of it linked to the inequalities and the massive inequalities that have developed under neoliberalism especially. And so therefore, if you're wanting reform, you need to be a socialist and you need to nail that colour to your mast, because otherwise we're not really getting to anywhere with this. And I'm not saying that if you have a socialist transformation of society that you would automatically get rid of drug taking, because there are other causes as well. But obviously the majority of it, the causes of despair and unhappiness, because it seems to me that what drugs do is offer comfort and escape, and the more unhappy you are, the more you're going to want to do those things. And for people like me, it is overeating, I'm sure. And then capitalism and marketing and advertising are very much focused on the aspects of giving comfort and escape and encouragement to indulge in behaviours that are really bad for us psychologically and physically, mentally, everything. And the final question is, so that question is all to do with, shouldn't you really just be saying you want a socialist transformation of society, and you're looking at the drug problem within that? And the second is, it seems to me that generations gone by, pub culture was the thing, and people got their comfort and escape through the pub. And we know that pubs are closing, and people like rubbing their hands, and why is this, and they're regarded as community assets and things like that now, and we should try and encourage them. But shouldn't we just acknowledge that there's been a cultural shift away from the drug of choice, in that lots of people just go take drugs now, they don't actually go to the pub? So yeah. Ooh. So do you think that could be a reason why pubs are closing as rapidly as they are?
Cool. Thanks, Vicky. Rebecca.
Great questions. I love this. So ketamine is a licensed medication that is used in veterinary science, and it's also used in dentistry. It's also used in anesthesia. So the thing with ketamine is trials have been done on that more than others because it's a licensed medication. So things like psilocybin, which is the compound in magic mushrooms, which has been used to kind of alleviate depression. And people often talk about using mushrooms recreationally, and people talk about this afterglow effect. So in the week after, so usually when you think about drugs, you think take drugs, feel the effects, come down from them in some kind of way, hangover or no hangover. My dad, he's 73 now, still professes he's never had a hangover, even though he drinks every single night. Maybe that's the problem. But it's kind of, your body metabolizes different substances in different ways. And I think So I think one of the things, and I'm probably going to answer both these questions in one. So yes, state regulation, yeah, you know, definitely that would be a great way to go, but thinking about different substances for sure. Coping mechanisms, really glad that you both have kind of brought this up, and you know, certainly around kind of sugar and food and comfort and what we need. We need all of those things, and we are finding a lot of comfort in different, you know, different substances, whatever they may be. I don't think sugar should be banned. However, I do think that we kind of, you know, I think everything in moderation and everything in balance, but I think that's easier to achieve for some people other than others. You know, like we know, you know, how easy is it to have one glass of wine and stop? Well, it might be really easy for some people and not for others. You know, like it really, I think what we're moving towards, and why the public don't feel like blanket bans are the right way to go with anything, is because people react to different substances in different ways. This kind of leads on to what you were saying about pub culture. And actually what you're finding that young people are doing now is not going to the pub, it's not going and taking drugs, it's going to the gym. That's what they're doing. They're boring the youth, you see. So, you know, they've moved, you know, we're seeing a kind of a very much more health conscious young people than we've ever seen before. And actually, if we look at generations, we'll see that Generation X, so I can't remember when people are born in Generation X, but it's people who were growing up in the 80s and 90s, so they were teenagers in the 80s and 90s. They were the most drug involved. So if we think about illegal drugs, so they saw the rise of ecstasy, generation and dance culture. It was kind of after amphetamines and punk rock and all that kind of stuff. They were the most drug involved generation. And actually, when we look at statistics, we can see that that generation is still using drugs in their later life as well. So they're either reinstating, starting, or just continuing to take drugs. But actually, younger generations of people, although the, you know, drugs, you know, drug use still exists in society, it's actually dropped since the turn of the millennium. And, you know, obviously different drugs are taken, but, you know, why? But what young people are doing is Botox, lip fillers. So they are doing, so this is, it's a different type of substance use, isn't it? It's a different type of drug use within society, and probably something that seems quite alien to, you know, generations, different generations. So maybe isn't about changing psychoactive substance use, but it's about it's about changing the way that you look, and it's changing the way that you are. And we're doing that through the gym. Well, I say we, not me, doing it through the gym. We're doing it through different types of cosmetic surgeries, those types of things. So, you know, culture is ever changing. Nobody wants to do what their parents did. Each generation wants to be different from the rest. And actually, I think what we're seeing is lots of young people rejecting drug use altogether, and alcohol use as well. The body has become a temple, and alcohol use is seen as something that is destructive on the body. And therefore, I think in terms of pub culture, certainly people come in a lot more health focused. You know, I worry about kind of things like, you know, too much sugar and too much, but too much diet culture as well. You know, like I think diet culture has been a massive profitable business that has taken people's money for years and years and years on trying to do quick fixes. And I think that, you know, thinking about this in terms of, you know, why are people using substances, you know, or why are people overeating? We need to think about that. And yeah, it can be a coping mechanism, and it can be, you know, to do with the strains of life as well. And we just need to give people a break a little bit, and just not. And the thing that I want to try and avoid is a lot of kind of internal shame about whatever that is, and, you know, trying to understand about different substances, how they affect you and yourself and your body, and that if you want to try and stop doing something, or if you want to try and change your behavior, that there is support, there is kindness, and there's compassion in the way that that is done. That to me is the most important thing. And I sometimes think that we are our own worst enemy when it comes to things like that, because we have all gone through the worst possible year. And, you know, for me, if a cake makes you feel better, or a pint, you know, just give yourself a break. We're all suffering because we're not seeing each other. And I think that's my big thing about the social isolation. And as you say, I hope that once we start to open up, and I hope that we can try and all be kind to ourselves and each other in doing so.
Wow. Thank you. I think the 2 words which you said then at the end, kindness and compassion, says it all. Says it all. It really is. And if we were kind and compassionate to each other's, we wouldn't have half the problems we have now. I wish you all the luck in the project you're doing. I would very much like to invite you back when the project is finished, and if you're going to start another one. But I would love to know the results and what happened, and whether it is effective, and what has actually changed. And it's been absolutely fascinating to listen to what you've had to say. I'm absolutely delighted. I looked at your webpage, because it's been an absolutely brilliant hour and a half. Thank you very, very much indeed. And I hope you come back again. I really do.
Thank you so much for having me. Thank you for all your amazing questions. I really wish that the students that I teach were so engaged in what I had to say as you all have been, because I've thoroughly enjoyed that. And yeah, thank you for having me. And yeah, all the best to you and your group.
Right, no problem. Well, we've got now